I am happy to make a few remarks on this very important issue this afternoon. The Scally report has laid bare a scandalous catalogue of failures right across some of the most sensitive areas of healthcare in this country. The women and the families who have been affected, and in some cases utterly devastated by these failures, are the true heroes of this entire sorry saga, and their bravery cannot be commended enough. The report that indicates that we have reaching a tipping point in the level of dysfunction that affects the HSE. But we all know that for a long time, and Minister, you must know it now after 2 years in office as well. And when are you going to do something about it? Dr. Scally observed how apparent it is that there are serious gaps in governance structures of the screening services. In the specific case of cervical check, there was a demonstrable deficit of clear governance and reporting lines between it, the National Screening Service, and the higher management structures of the HSE. This confusion, according to Dr. Scally, complicated the reporting of issues and multiplied the risks. We need to let that sink in. That's the confusion. And here we have a so-called healthcare service that actually multiplied the risks to women and their families. They're going in there for checks in their own interest, and as a deputy from Galway stated, she's not here to tell people to go for checks or whatever. It's up to people themselves. But they must have confidence. But you think then that this is where they ended up. How can we have confidence? As I said, Dr. Scally also noted that there were serious gaps in the range of expertise in the professional and managerial staff that are really engaged in the operation of cervical check. In one of his recommendations, Dr. Scally says that the Department of Health and the HSE should revise their policies in respect of document management. The implication here is that the HSE document management at present is not reliable and does not ensure accountability. And I honestly feel that's a deliberate act at this stage. I mean, I've seen such a catalogue of it. It's deliberately done, the way there can't be any accountability. Indeed, Dr. Scally says the view was expressed to the scoping inquiry by some working within the National Screening Service that screening was downgraded after being absorbed into the HSE, and they felt that they had little influence within the HSE as a whole. And that's common practice. We see no matter what service is absorbed into this monstrosity, it gets lost. I mean, lots of good people into the HSE, and lots of good people absorbed into it, but it's such an unaccountable and unwieldy organisation now that it must be disbanded. Among other findings, the report noted that there continues to be a somewhat negative relationship and clear disconnect described by the programmes between themselves and the HSE chain of command. Issues of isolation, suspicion, lack of trust or support, and poor or non-existent communications were cited. And we're going to have this, and we're going to continue with this, Minister. I've asked you, and indeed you walked into Castle Hospital one day with Deputy Healy, myself and others, and you were shocked to see it lying idle. There's so many instances. And you've done absolutely nothing about it. An abject failure. And then the selective leaking of this report, I'm not blaming you, but only a handful you had it, of parts of it, was despicable as well. It's a case of cover back sides all the time and allow the HSE and senior management at HSE and the department to cover themselves and wheel into court, wheel into balances when it happens. It's despicable, it's degrading, it's disgusting. And you're presiding over that, Minister, and I've called on you several times to resign, and if you had any moral compass, you would resign.
Now,